So where are you exactly? Are you in California?
I live in Northern California. I'm in Dallas right now with my daughter.
Ah,
He's going through rush.
ah.
Yeah.
So
And you're in New York.
I'm in New York and getting over the virus that everybody, I mean, it's like the most, I never got COVID and I sort of breezed through all of that. And then everybody here just got hit with this virus that doesn't leave. Like it gets you and it comes back. And then you think you're over it and it comes back again. And so, I mean, I said, I don't mean to be bossy, but can you all put masks on or do something? I don't know. We need to take an action here because
Yes.
it's really, really, um, distracting to say the least. And in New York, we're on top of each other. You know, you can't travel anywhere without breathing on your neighbor. So, but, you look healthy and happy in Dallas. So anyway, I just have to say, I'm a big fan. I have an intense curiosity on healthy lifestyle and longevity. And I love interviewing doctors who are sort of really doing interesting things. There's so much that's happening so quickly. And, you know, every time I think about you, I think, you know, there's David Sinclair, Peter Attia, and like you are like so freaking cool and smart. And, and I think, wait a minute, guys, move over. She's She's like, you know what I mean? I've been thinking and thinking, where is the feminine representation in this story? And I thought, of course I know where the feminine representation is. And so I kept telling everyone, please, 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 let's figure out a way where we can have a conversation with Sarah and let people get to know what you're about. What I'm going to do is I'm going to just read, which I typically don't do, but I really want to do this before we begin. Um, so your background, graduate of Harvard, medical doctor, over 25 years of experience, author of 4 New York Times best-selling books. Her latest book, The Autoimmune Cure, so excited about that, is set to release on March 12th, 2024, and focuses on how trauma can activate autoimmune diseases within your body. She provides her plan to bring your body back to equilibrium and heal itself. Awesome. Awesome. Congratulations. It's really
Thank you.
great meeting you.
Wonderful to meet you. Thank you for all the transformation you've done in the world. We're aligned.
So my first question actually is just a curious one because you're such a good writer and you're so, there's an intimacy about the way you communicate that's very comforting and trusting. And I think your communication skills are so incredible that I wonder, just as one woman to another, like what came first in your realization of self? What was it, writing? Was it communication, or was it, you know, medical interest, curiosity? What was it?
Such a potent question to start with. I feel like I feel like I figured out early on that if you've got a mission, if you really want to change the conversations in the world, you've got to you've got to be a messenger. And I mean that in the deepest, most profound way. You know, we've got to, if we want to shift culture, if we want to be cultural leaders, you gotta take really complex topics and simplify them without oversimplifying
Yeah.
them. So the intimacy that you're talking about, I would say that's really about taking people by the hand and taking them through this process, especially with things that in the past have been so opaque to us, like what's happening inside the body. I think there's so many women and men who are really sophisticated with their line of professional work. And then when it comes to the body, there's almost like this way that they hand it off to their doctor. Not you, of course, because I know you don't. But there's a way that we can get disempowered.
Mm-hmm.
And I saw that really early on through the past 56 years has really been to say, let's do this together. Like, let's find a way to body that you have, whether you're male or female or somewhere in between. Like, let's find a way that really allows you to serve your mission in the deepest way possible.
So, there's so much truth to really feeling overwhelmed by the responsibility for our health and our bodies. It is overwhelming. And unfortunately, we really have to be our own advocates, and it's really hard to do. It takes a lot of work. I really love the direction you're taking with your book, the new book, and I've been thinking about trauma so much lately because, and I didn't nail it the way you have. It's so clear. In my mind, I've been thinking, what exactly is trauma and what's happening to us? And is it as simple as listening to the news or is it, a life crisis, a typical life crisis? When you turn 30, you have one life crisis. 50, your house can fall apart. Your whole life that you understood can fall apart. These traumas are not rare. They're so much a part of the way we live that there's no wonder that there are so many autoimmune diseases. And what made you think about, which I just think is so brilliant, what made you think about really getting on the trauma topic? Nobody is.
There's several reasons. All of my books are really prompted by what I observe with the clients that I'm taking care of, and also what I'm observing with my own matrix. I became estranged from a family member. And I feel like this is a common story. This is what we would call a small t trauma. It's not the same as, the Holocaust or surviving 9/11, but these small t traumas can still affect your network, the system of your body in profound ways. So I started to observe how many of my patients with autoimmune disease, I mean, first of all, the rate of autoimmune disease is rising, but I saw so many of them had a history of trauma, either childhood trauma or maybe birth trauma, related to having kids, or frankly, now that we've made it through the pandemic, I don't think anyone has survived without, some experience of trauma. So what is trauma? It's an overwhelming experience. And in some ways, the capital T traumas, like I mentioned, surviving 9/11, having someone that you love die suddenly. It doesn't matter in some ways whether it's a capital T trauma or a small t trauma. Trauma is how the experience lives on in your body. So there's a particular signature to trauma. It affects what I think of as the PINE network, which is the psycho-immuno-neuroendocrine network of the body. So that's kind of a complex topic. But what I find, for instance, is some people go through a traumatic experience like this estrangement I had with a family member, and it really affects their psychology. It leads to depression, anxiety, maybe post-traumatic stress disorder, or what I think of as partial PTSD, which I see in so many of my clients. Or it might affect your immune system, like it did with me and with a lot of the clients that I was tracking. It might affect your neurological system. It might affect your hormones. It might lead to cortisol. It's just totally out of whack. Low, both within the same day. So I observed this pretty dramatic increase in trauma among the clients that I was taking care of. And then I also had this personal experience with trauma. And that got me to say, how do we track this in the body? Because I feel like up until now, so much of the conversation, Norma, when it comes to trauma, has been more in the mental health realm.
Mm-hmm. Yeah.
And I think that really limits. I mean, yes, we need to focus on that. We need to focus on trauma-informed care. But I feel like there's so many of us who are having trauma embedded in our bodies and don't realize the way that it's affecting our ability to focus. It might give us ADD symptoms, the way that it affects your immune system and maybe lead to Hashimoto's or multiple sclerosis, the way that it might affect just your ability to relax and restore each day.
Yeah.
Really meant to be doing, and often not enough of us know how.
No. As you're describing this, I'm thinking about, I have a company filled with women, and different age groups. And I've been in business 56 years. So I've seen generational differences, but some very constant experiences. And in the group, I would say 25 to 35. There's a common thread of a trauma type experience. And it has to do with this stuff women are convinced has to be a part of their life experience at, say, 30, where they have to find the partner, they have to achieve certain things at that point, or their life is running away from them and they feel less beautiful, less able to achieve anything. Everything is taken away from them in some way that is really so hard to understand, except we all have had the experience of some guy cheating on us and making us feel like shit, or not getting the goal you want at a certain age where you feel you have. We've all had some version of that. And I really believe that that's trauma of some level of a size T. And I really believe it never goes away. And it sort of starts this building of trauma number 2, number 3, where you end up at some point, which I've seen, and just listening to you, I've seen people literally have these illnesses that nobody can figure out. And they all seem to come after this period of time. And for me, I got divorced at 29, which shows you my generation. We got married fairly early to get out of the house. But I remember the trauma of divorce at 29. I was married 10 years. We were in business together. So I am also, one of these people, women especially, who had that experience. Do you think in in looking at how trauma is just, it doesn't happen once, right? It's sort of this ongoing life opportunity in some way. How does that reconcile to good health when you're not aware, or haven't been until your book now will make people aware of it?
Yeah, well, so here I'm going to have to take off my doctor hat and speak more as a human in a female body, because I think you're asking about almost a spiritual question, a question about, I would describe it as this period of time in our 20s and 30s where we have to reconcile how hazardous it is to be female in our culture. And I think that alone is traumatic. I think being female is traumatic, at least the way that we treat women right now. So it's interesting to consider. And as you were talking, I was thinking in particular about my daughters. So I have a daughter who's 24. I've got a daughter who's 18. They're very different in how they walk through the world. And the 24-year-old reminds me a lot of how I was in my 20s. I was incredibly ambitious. I felt like I had all the answers. I had a seriousness about it. And in some ways, going through this process of training in the medical system and sort of adjusting to the patriarchy and the trauma of medical training, it led to losing some of that sense of invincibility that I had when I was in college and afterwards. And so I don't know if that's exactly what it is that you're talking about, but it feels like there's a way that women by around age 25 start to confront these limitations that they're faced with. And they either choose to kind of take them on and sink their teeth in, or they maybe start to retreat and start to go into more of a people-pleasing role or an accommodation role. A lot of it also depends on childhood patterns and adverse childhood experiences, who you had to be as a kid to get the love and attention that you deserved. I had to be a performer. I had to be an overachiever. I had to be that straight A student who was the smartest kid in the room. And so that became my set point. I just was always used to kind of revving at this level, which can lead to autoimmune disease because it's a lot of energy to be running through your system.
It is.
And you don't always speak your truth. Sometimes you're living someone else's idea of who you're supposed to be in the world. So I don't know if that exactly matches up with what it is that you're noticing in your company. What do you think?
Yeah, I think that is very much obvious in that age group. But I also think that retreating starts to happen, and then some really strange decisions about what is beauty to them and the influences on social media of what to do with your face and kind of makeup and the way you dress starts to create a persona that you believe will achieve the results you want, because the results you want are not being achieved yet. And, I just got married a month ago. And so I always say, be patient. It may take time to find the right person for you when you're ready. And so I wasn't ready, and they may not be ready either, but that's very hard to reconcile at that age. But I think that the trauma, that part of it, really does take a toll. And not only the trauma, but then especially for women who are very fashion conscious of how thin are they and how, all of those kind of requirements that they put on them instead of just thinking maybe a healthy lifestyle might be another way to achieve it. So I think the combination and then the results and so when you talk about autoimmune diseases, what are the autoimmune diseases that seem to be the most common sort of reaction, or the ones that are the most um, obvious to identify in relation to trauma?
I wish we had a rank order of how correlated different autoimmune conditions are to trauma. The ones that seem to really stand out are rheumatoid arthritis, lupus, Hashimoto's thyroiditis. But there's also, there's the classic autoimmune diseases. I also mentioned multiple sclerosis earlier. And then there's maybe a broader way of defining autoimmunity. So I think of autoimmune disease as some of these classic conditions that I just described, but there's really a spectrum, and it includes the attack of your own tissues, in which I would put a few other conditions that are highly, highly correlated with trauma. And that includes fibromyalgia, irritable bowel syndrome, endometriosis. The rate of sexual abuse, sexual trauma, and endometriosis is very high.
Wow.
So,
Wow.
so we want to consider all of those. And, I think it's important also to say, I'm not saying that everyone with autoimmune disease has trauma. I'm not saying that everyone who experiences trauma is going to have autoimmune disease. I'm just saying they're highly correlated, and it can point us in the direction of particular solutions that address the trauma, and as a downstream result can also address the autoimmune condition.
Yeah. Well, and so in your research and putting the book together, I looked through some of the concepts in dealing with trauma, and they're very innovative and they're very provocative too. But I'm thinking nobody's solved this autoimmune issue, and it takes exactly what you're describing as like, you know what, just got to get in there and make it happen, make it happen. And it means you're not gonna, it's not 2 aspirins and go to bed. It's going to be a provocative approach. So how did you discover this sort of new look at dealing with an illness or a disease? How did that come about?
I probably should credit my great grandmother here.
There you go.
So she was a radical. I grew up in suburban Maryland, and she used to come to our house. She lived in Palo Alto, and she was a whole foodist. She took no prescription medicines. I think she had like a glaucoma drop that she used at age 97 when she fell asleep. She died in her sleep at 97. And she really believed that you don't find the answer to health in the bottom of a pill bottle. You find it in the way that you architect your life. And I know you know that very well. So she's someone who had a huge influence on me. She taught me yoga when I was 5. She taught me meditation. She got me to do transcendental meditation when I went off to college at 17. And I feel like when I went to medical school, I really connected back to this foundation that I had with her, where I felt like there's so many people who are failed by this healthcare system that we have. And when I looked at these patients that I was taking care of and all of a sudden had such a spike, the universe was sending me all of these patients with autoimmune disease, I realized, gosh, this is a group of people who are so failed by the modern medical system. On average, they wait 4 to 7 years for a correct diagnosis. They see 4 to 6 doctors before someone puts these mysterious symptoms together of the joint aches and the fatigue and the, difficulty with focus and brain fog. And so it was these little pieces that really coalesced. My experience with my great grandmother, the way that she shaped how I take care of patients, and then this uptick in taking care of patients with autoimmune disease, which of course increased hugely during the pandemic. We saw so many vaccine reactions and long COVID, which we also think of as an autoimmune condition. And so that together got me to kind of turn the view toward how do we help these patients, and how do we do it in a way that's not just suppressing their symptoms, which is what I was taught so well to do in my medical training, but it really falls short of creating the kind of health and healing that most of us want.
Yeah, I love the grandmother part of it, because it really is those early experiences that they're setting the path for us. I think of my mother in the same way, and all of her what seemed wacky and eccentric methods really serve us well if we remember to pay attention to that. I think one of the things that I think would be super helpful for people, and now with your book, they'll be able to use your book to kind of identify if what they are experiencing sounds like this trauma trigger, or maybe not identify the trauma, but understand that there is an autoimmune disease. If you were to think about just from a healthy lifestyle perspective, and just being proactive to deal with the stress and the trauma that we all deal with in like small t's probably every day. What are some ideas that you have that people might want to think about, not as the solution to this, but as taking steps to kind of protect yourself in case of, or understanding it's likely that it will happen? What are your thoughts about that?
It starts with embodiment. So when I talk about embodiment, honestly, it's still kind of a new concept for me, because just as I was describing to you the way that I grew up and, sort of this type A hard driving personality, I was someone who chronically dissociated. So the way I would deal with, sort of the daily traumas of life, the daily exigencies of life, and especially when I was going through my medical training and you're working in the emergency room and you've got, a car accident that comes in, or an emergency C-section on a patient, whatever it is, I would dissociate. And we were very well trained to become more cognitive and super hyper focused as we experience trauma. And so that was very easy for me. And I would dissociate as a kid. I remember telling my mother, Mom, sometimes I feel like I'm up on the ceiling, kind of watching what's going on. And she didn't have much in the way of psychological skills. She just said, well, come back down. Like, it has taken, for me, it's really taken the past few years of going through somatic-based mindfulness training, a method called Hakomi, and also psychedelic-assisted therapy to get to a place where I am now 100% in my body. I don't go upstairs when I am feeling toxic.
Really, that's fascinating.
It's
Because,
fascinating. And I think there's a lot of us who are functionally dissociated. So I think the first step is being honest about that and to get a sense of how present you are, how fully embodied you are. I think the second step is to do a trauma inventory. So in the book, I've got an ACE questionnaire. You can also go online and Google one and just see what your adverse childhood experiences are. And most people realize, okay, childhood trauma, greater risk of depression, anxiety, other conditions as you get older, they are associated with more than 45 chronic health conditions now.
Wow.
So stroke, autoimmune disease, cardiovascular disease, cancer, all of these things are associated with your exposure to childhood trauma. Then, of course, there's adult trauma. You mentioned your divorce. That's a big one. I just went through a divorce in the past year, so I had my share of toxic stress in the past year.
Yeah.
And I think it also comes down to how you deal relationally, like really looking at the quality of your relationships. You said you got married a month ago, and I want to hear more about that. But, I grew up, Norma, in a way that no one, when there were ruptures, these inevitable, ruptures as part of human interaction, the ruptures I had as a kid never got repaired. Never. They just got brushed under the rug and on to the next thing, and let's pretend like that never happened. And so as an adult, I had to teach myself how to repair ruptures. And that was especially important for me with my daughters. So I would say these are all some of the stepping stones, as you mentioned, to assess how much trauma is alive in your system. Because there's a lot of people who experience trauma, childhood trauma, adult trauma, who then resolve it. And it doesn't, kind of continue living in their system, causing dysfunctional relationships, causing dysfunctional metabolism, causing, autoimmune disease and other conditions. So a lot of it is how you cope with the trauma that you experience and how embodied you're able to be as a result of it.
Yeah. And so when you say people resolve trauma, do you mean to therapy or some clinical version of that? Is that what you're talking about? Yeah.
Yeah, I mean, this is where things get really interesting, because when I did the research looking at, what the Veterans Administration, for instance, recommends for their veterans with post-traumatic stress disorder, PTSD, they recommend talk therapy, increasingly trauma-informed talk therapy, but talk therapy sometimes paired with selective serotonin reuptake inhibitors. The efficacy for talk therapy for trauma, for PTSD, is somewhere around 30%.
Really?
That's pretty poor.
Yeah, I'm shocked, actually.
And SSRIs, the 3 that are FDA approved for PTSD, are pretty similar. So a 30% efficacy. I feel like when I first started therapy, when I was in my 20s and I started talking about trauma, if they said to me, the effectiveness of this is 30%, I think I would have been, well, forget that. Like, it's not worth the time and the money to do that. But then you look at things like the 2 randomized trials that have now been published in Nature, one of the most prestigious scientific magazines that we have, scientific journals. They show that with severe PTSD in the first randomized trial and then moderate to severe PTSD in the second randomized trial, you get somewhere around a 67 to 71% resolution of PTSD. with 2 to 3 sessions of MDMA assisted therapy.
Really?
So more than double as effective. It's really important to understand that. It's a completely different model than this idea of waking up in the morning and taking your selective serotonin reuptake inhibitor and then going to talk to a therapist once a week.
Yeah. So let's talk about that. Let's talk about some of these really provocative approaches that just at first when I read it and read your list and looked at everything, I thought, whoa, holy shit. I mean, she's going there. And I thought, oh my God. And then I thought about it because my brother had a very complicated life of drugs, alcohol, a veteran, levels and levels of difficulties. And I kept thinking, what else can be done? What else can be done? I felt so helpless. I did not, and if you know anything about me, I keep digging until there's a solution. And I thought, holy crap, it's right here. It's right here. Except unfortunately, he committed suicide and wasn't able to survive a horrific life. And I look at this and I think this needs to be understood, more commonly understood, so that people have an open mind about the possibilities and the opportunity. Tell me a little bit about how you sort of went into this direction and any personal experience you might have to share.
Well, first, I'm so sorry to hear about the tragic loss of your brother. It's that just sounds devastating. I can't even imagine.
It's a tough one. It's tough. And it's not, I'm not singled out here. This is so common, that when I'm reading this and I'm seeing this, I personally am like, whoa, why didn't I know this? And to just see what you've done, I think is going to be, a point of interest for a lot of people who are down a road and don't know where to go. And someone like you writing about this and having that really trusted kind of persona, I think this is really an extraordinary thing. So, but I'm so curious to know how you got there, any experience that you've had, everything.
Well, I'm not quite in menopause yet. I'm 56.
Oh, girl, are you kidding? Oh my God.
I've been in perimenopause a very long time.
Oh my God. That's awesome. That is awesome.
Well, I mention that because I feel like, I've written a few books, and my books started out mostly talking about hormones. Hormones, I think, are a portal to healing states of consciousness, and that's what I most love to write about. And going through perimenopause, it's an initiation. It's an initiation into a completely different role in our culture. And you also start to speak the truth about things that are riskier and more loaded. So I am delighted to really take on this topic, because right now, with the revolution that we're seeing with psychedelic assisted therapy, most of the psychedelics are kind of under the purview of psychiatrists.
Yeah.
And I think we need to broaden our concept of how it's not just mental health that captures the suffering that people have. There's a lot of physical suffering too. I focus first on autoimmune disease and the connection to trauma, but the other piece is I'm certified as a psychedelic assisted practitioner, and so I have been providing my clients with psychedelic assisted medicine, with psychedelic medicine and with coaching along with it for the past few years. So personally, I'll speak personally first, and then maybe we can talk a little bit about some of what I've seen with clients. I did my first series of ketamine experiences. And ketamine is kind of interesting. It's a FDA approved medication that's mostly used. I've been using it for 30 years.
Really?
As a physician. So we use it in the emergency room, we use it in the operating room, and it's used as an anesthetic, but at 1/10 the dose, it can actually act as an entheogen. It can act as an empathogen. It can open your heart. It can increase neuroplasticity. It can help you with that stuckness, that cognitive rigidity that I would imagine your brother probably had.
Yeah.
So ketamine is FDA approved for treatment-resistant depression, and so it's being used in that context. It's also being used and studied in eating disorders, in premenstrual dysphoric disorder. There's a lot of different contexts in which it's being studied right now. So my first experience was with ketamine. And then I also had personal experiences with MDMA-assisted therapy. And I found that that was probably the most profound for resolving past trauma. So I've gone through a total of about 10 experiences with, led by a psychologist. So I think it's important to realize I'm not saying go out and take MDMA.
No, right. It's good to add that little factor. I think,
yeah, do it with someone who is well trained.
Right.
The psychologist found that combination to be just truly transformational to me. I also really believe in psilocybin. So we've benefited from Michael Pollan talking about some of these medications. He's got a glorious description of one of his trips on psilocybin. And there's such a long, thousands of years old practice and experience in indigenous cultures with some of these medicines like psilocybin, like ayahuasca.
Yeah.
I've had an experience with many of them, not with all of them. I'm still learning. And one thing that's really critical is that you've got time to integrate what you learn when you go through one of these experiences. And so that sets a certain pace. So for me, that's a ceremony or a journey about once a quarter. That's what works for me personally, and maybe even less often, like once every 6 months, so that I'm really, kind of collecting the jewels of the experience, deep mystical experience, and applying it to my life. But what about you? Can I put you on the spot? Have you tried any of these medicines?
Now, you are talking to someone who, quite frankly, had I not had this experience with my brother, a lifelong experience with him, and recognizing when I read some of what you've written, like a bulb went off in my head. Oh my God. Oh my God. Now you're talking to someone who doesn't smoke. I never drink. I've never taken any drugs of any kind. And so I'm one of those people, well, no, I have to really be in control, but I love meditation. I love different forms of acupuncture and other experiences. So there's obviously, I like the experience of allowing the spirit to kind of just relax. But anytime any of my friends were going to do anything, whatever version of this, I was like, no, not me, not me. And I wasn't judgmental. And I have learned, because I like having friends, that if I'm not going to drink, nobody's going to know that I'm not drinking. I hate when people kind of make everybody uncomfortable with whatever their bullshit is, right? But for me, for many reasons, that this is a path I've taken, and some childhood experiences, some other experiences that created that in my head, what it should be. But for the first time, my mind opened up, because I understood what you were saying because of the context you put this in. And it never really been in that context for me before. It always seemed quasi-recreational, right? And the amount of drugs and alcohol my brother consumed was just so frightening to me. I mean, from heroin to everything you can think of, that I had such a fear of anything like that in my life. I had to protect him. How I couldn't let anything like that happen. And the bottom line is, when I saw it recreationally used by friends I love and who enjoy it, and it's like, Norma, of all people, you should be. But now, in reading this, I'm doing great endorsement for your book, by the way. In reading this, I am understanding how someone with addiction, and we have a huge epidemic, that someone with addiction, with assistance and medical kind of advocacy, could really make some breakthroughs and see changes. And you can save somebody's life, my brother's life, possibly. I don't know for sure. And he would have tried anything. He read every book there was to read about helping cure himself. He was brilliant. He had an extraordinary IQ. He wanted to heal himself, and he just fought a tough battle. And he would have tried this because he wouldn't have been afraid of it, but he would have tried it because of exactly what you're explaining here in the simplest terms, right? And the idea of trauma and all of these experiences people have in their childhood, whether it's, being molested as a young child and having that secret kind of stay with you through your life, and tell me that that's trauma is not going to destroy a life in some way, or having, abusive family situations, or examples that are really not good for children to use as guidelines for life. That there needs to be a way to deal with this, and an understanding that there is an option where there seems to be none. And yes, I think it's so great for autoimmune diseases. I really do. I think that that's, so many people walking around with no answers. But I really think there's going to be a way to look at this through the way you've written this, for other things that are controlling your life, or having you trapped in this box with no way out. I think that this is very exciting. For me, when I look at this, well, tell me a little bit about diet. Let's start with diet. But I just really want to thank you and I had no idea that this conversation with you is going to go in this direction. And it's such a personal revelation for me that I'm so grateful. I do think understanding some of these other tools like diet, sleep, supplements, breath work are really important too. And why don't you talk a little bit about diet as well?
Well, we got into psychedelic assisted therapy kind of right from the start, and
I couldn't wait.
I couldn't wait either. So I'm glad that you're reeling us back to some of the basics, the foundational elements, because the way that you eat, I mean, the foods that we consume, that's the main way that you interact with your environment. And so those foods can be the most nourishing, or they can be the kind of foods that really trigger inflammation and trigger autoimmune disease. So we want to be really careful about that. And I wanted to say one other thing. I was so touched when you said that that you have never used drugs, you don't drink, and there was something about that chapter maybe on psychedelic assisted therapy that pierced your veil. I had a similar experience. So I grew up totally square, never took any drugs at all. And, occasionally would drink a little bit, but not much. Never smoked pot, never did mushrooms in college, never took ecstasy. I never did any of those things. And then when I had this experience of this devastating estrangement with a family member, this was about 4 or 5 years ago. And I started to look at this data on MDMA assisted therapy. And I said to myself, hey, I'm 50. If not now, when? Like, I want to heal this trauma. If trauma is getting in the way of my relationship with this family member, I'm going to do everything I can, clean up my side of the street, including trying some of these more avant-garde treatments. So that was the context. And getting back to the basics. So with food, what we know, and we've had studies on this for decades, and yet it's not common practice among mainstream conventional physicians. And I don't mean to throw them under the bus because I trained along with conventional physicians. We need them. But we know with rheumatoid arthritis, if you do a really careful elimination diet and you cut out gluten and dairy and eggs and the things that are the most common triggers of your immune system, and you do that for a period of time, at least 6 weeks. For some people, it needs to be a little bit longer. And then you very meticulously, slowly add back one food at a time to see how you react to it. That can make such a huge difference to your immune system. And then, of course, sleep. We know that you need 7 to 8.5 hours of sleep to really, for health span, for your immune system to work properly, for your cortisol to not be a hot mess the next day. We know that you need purpose and meaning and connection with other people. You need love in your life. You need movement. You need exercise. You need all the things. You need a way to quiet your mind and create a state of restoration. So for some people, that might be yoga. For others, it might be meditation. And it's an important point that not everyone needs to do psychedelic assisted therapy. There's lots of ways to get into healing states of consciousness. Breath work can do that. I experienced it with TM starting at age 17. I experienced it at age 5 with yoga. And I still experience it with holotropic breath work, with orgasm. There's lots of ways to create these healing states of consciousness.
Yeah. It's so true. And it's, what I love is to be able to track some of these things like sleep, to really have a better understanding of what a good night's sleep feels like, right? When the next day you feel amazing and you think, what the hell? I gotta see what happened last night. And it's like, oh, okay. The interesting thing was when I got this virus, if I could avoid any drugs, whether it's, antibiotics or steroids or whatever, I do, but I tried to stave it off and it wasn't a good idea. And so I had to take medication. And when I took the medication and I tracked my sleep, and I thought that I was sleeping because I was sweating and sleeping through the night, it turned out that I was sleeping 20 minutes, deep sleep 20 minutes, REM sleep 30. Can you imagine? Can you imagine? Can you imagine? And when I stopped the medication, done. I was back, REM sleep, deep sleep, my typical, I'm a sleeper, I was like, holy mackerel, who knew? I had no idea. So I love the idea of tracking so you know exactly how your body is responding to whatever it is, or what a good night's sleep feels like versus what you think. Oh, I slept 8 hours. Maybe you did, but you're not restoring here. Something's not working. And so I really have a real respect for being able to be aware, like you said, of taking ownership of what's going on with your body, and whether it's tracking or different forms of tracking. What are your thoughts about that? Do you track?
I do. I love trackers. So I've got a ring on. I wear a Garmin watch for the physical fitness that I do. I like to lift heavy, so I like to track how much stress my body's under and how much I restore and recover.
Mm-hmm.
So that's always a challenge for me because my mind pushes me further than my body sometimes wants to go. So I'm so glad you raised this point about wearables. About 50% of Americans use wearables right now. We think within about 7 years, it's probably going to be closer to 100%.
Wow.
They give us so much information.
Yeah.
They take, as you described with sleep, you wake up in the morning, you don't really know what happened the night before. You might have a sense of feeling good or bad, but to get that kind of specificity of your deep sleep, I like to get 2 hours of deep sleep every night. Your REM sleep, how many interruptions you had, your temperature during the night, your heart rate variability, which is a measure of your autonomic nervous system, kind of your on button versus your off button, your fight, flight, freeze versus your stay and play half of the autonomic nervous system. So I'm a huge fan of wearables. And you had asked earlier about, what are some of the stepping stones to trauma, and maybe you had trauma signature in your own body. And I think a wearable is a great way to assess that.
Oh.
Huge fan. And I'm the director of precision medicine at the Marcus Institute at Thomas Jefferson University. So I'm kind of obsessed with wearables. I love them.
Yeah, I do too. I just, the more information you have, the more you know about how you're doing. I mean, it's really so incredibly helpful. So when it comes to exercise, I love to exercise. It's just incredibly, important for me. In fact, as a company, we all work out together. I have a trainer come in and we get out the mats. We have a big, huge space and we all work out together. And as you know, exercise is not only good for the body and the brain, but the sense of achievement and the fact that you can reach goals that you didn't really think you could. And it sort of opens the the ability for you to do that in other parts of your life. And when we work out together, it's such a bonding experience. I mean, everybody, it doesn't matter what your job is, what your hierarchy is, the mats go down, everybody's like doing it, panting, breathing, whatever. And it's such a great experience. I think, for me, exercise and balance and all of the things that I, at 78, really want to make sure I achieve really are critically important for my head, my body. You talked about sensuality, sexuality. You can't connect to your body unless your body can move and can feel and has energy and can interact. And so it's so important, especially for women plus 56. I mean, think about what's your life going to be like from 56 to 78. It almost seems like, what? 78? Holy shit. Well, that's what I was saying. And I say I'm 78. My brain is so not thinking I'm 78. I feel like I'm just bullshitting and lying. But that period of time, the period of time you're about to go into, and I say this as a result of the exercise conversation, is because it gives you that energy and that physical strength that is really, really important through this next period. And if you're connected to your body physically through touch or energy in some way, you really can relate to other human beings in a much different way. And that is really important for women, in this part of the next part of your lives. What I would like to share with you, which has been the best part of my entire life. So you are about to enter my favorite, seriously, my favorite. And look at you, like this is it. This is really the best time. You understand your purpose. You look at what you're doing, look at this book. It's like you're giving so much for the community, for society, for the world, for everybody that has the opportunity to read your book. So it's very exciting. And I think it's that physical energy that's so much a part of this next phase, as sleep is too. But I really believe exercise is such an important part of it.
You raised such an important point. I mean, it's if our listeners hear just one thing today, I hope it's this particular piece about movement and about exercise, because I didn't really get this. I would say I would put exercise as a lower priority through most of my years until 56. And now it is the first thing I do in the day. I mean, I meditate, I get in the sauna, and then I exercise. And it's so good to hear about what you do in your company. Frankly, I want to come work at your company because it sounds like you've got some remarkable strategies in place to take care of your people and to, really walk the talk. And I love that. And at 56, I've got the strongest body I've ever had. I've got more muscle mass than I've ever had. I'm not a bodybuilder, but I really pay attention to muscle mass, lean body mass, because muscle is the organ of longevity, is the organ of health span. It's the organ of, feeling your absolute best for as long as possible, relatively free of disease. And the truth is, after age 40, you lose about 5 pounds of muscle and you gain about 5 pounds of fat.
Yes.
Every decade, unless you're doing something.
You have to do something. I love that you go into the sauna every day. I'm obsessed. I am obsessed. I have to tell you, through this whole stupid virus thing, I was like, get me to that sauna. And some days I didn't do them consecutively. I did morning and afternoon, and it was really helpful.
Yes.
Really, really helpful. I absolutely love my sauna. It's the best investment, and I'm just it. Talk about sleep. Talk about every. But tell me how you use it. Tell me how you approach your sauna.
Yeah, well, sauna is one of the most important levers when it comes to health span because it activates these things called heat shock proteins, and they're kind of like a way of going into the body and cleaning up the messes. So all of us just have this debris in our body just as a result of aging, and you got to go in and shampoo the carpets, like clean things out. So the way I use it is my favorite, especially in the wintertime, is to just get in there first thing in the morning without my phone and I meditate. So I
Hmm.
meditate for typically 45 minutes to an hour. And I like to keep the temperature of my sauna about 175 or higher. So
Wow.
I like it pretty
Do you have an
strong.
infrared or what kind of sauna do you have?
So I grew up with dry saunas, and the research really shows that the temperature has to be 175 or higher to get
Hmm.
the benefits, and you got to do it at least 4 days a week for 20 minutes. I
Yeah.
have an infrared sauna where I'm living right now, and so that I typically get around 150
Yeah.
degrees Fahrenheit. And so I do it for as long as I can, minimum 30 minutes, an hour if I've got the time.
Mm.
And I experimented with doing it after exercise, after weightlifting, but I find that it helps to warm up my muscles and warm up my joints so
Yeah.
that exercise is better.
Yeah. I like it. I like it at different times. Then I like it after exercise also. I find it very kind of, it's sort of, um, it's a meditation for me, for sure. And I do it with my partner whenever we can, when our schedules are together. And it's really great, to be together, and in silence. We never talk at all when we're in the sauna. And we just go in, and we know we're going to be in there for a certain amount of time. And our bodies are so used to, it's like it could be anywhere between 30 and 45 minutes, right? And we know the 30 point, just like we just know, or the 45. And we really enjoy doing that together. And we're so relaxed, so chill. He usually does it after he works out. That's his routine. And it's such a great thing for people. We go up to 165 with infrared, which it took time to get up there, but I just love it. I love every bit of it. And I especially appreciated it through this virus. I don't know if it's something that's recommended to do, but it just felt like I need to get in there. And doing it twice in a day was very, very helpful. I was surprised at the difference I felt in the next day when I did that.
Yeah,
So
well, you're speaking to, there's science to show that it helps with viral infections.
really,
So it does seem to support the immune system to be able to fight a virus.
hmm
And it's, most of the data that we have, and it's really well demonstrated to help you with cardiovascular health. It's almost a form of moderate exercise because your heart rate
right.
goes up as the temperature goes up.
Yeah,
So,
yeah,
I mean, it's very well proven to make a big difference. And as you said, I think it's really worth the investment.
yeah. I do. And I think I could talk to you forever, actually. And maybe
I
we
love
have to
that
do
work
it
for you.
again. I absolutely am so happy that we got together to do this, and I can't wait to get through your book and just really go through everything. This is a really good book. I know your books really well, and this one is very interesting, very unique, and I think the timing is extraordinary for a book like this. So thank you very much for putting the time into it and to pick something that is a topic that's so relevant for so many people. And thank you, Sara. It's such a great honor to meet you.
It's an incredible honor to meet you. I've loved your designs for so long, and it just means the world to me that you spent your time reading my book and interacting with it and connecting it to some of these personal experiences that you've had. So thank you so much, Norma.
Thank you, Sara. Have a lovely day. And I can't wait to get this out there for everyone. Thank you.